All right, let's move away from Nigeria and go to Zimbabwe now, where reports say nurses at the Harare Central Hospital have called on the public to join their protest against the government's failure to address their demands. The calls come at a time health workers, mainly doctors and nurses, have withdrawn their services over poor remuneration across the country.
Harare Central Hospital is the second largest referral center and reportedly does not have painkillers like paracetamol. Doctors and nurses at the hospital on Monday joined the nationwide strike by civil servants, citing incapacitation despite the government's 100% salary increment offer, which the workers say does not change a thing. Now, joining us this morning to talk more about this ongoing situation in Zimbabwe is Zimbabwe Nurses Association President Enoch Dongo. Good morning, Enoch. Thank you very much for joining us.
Morning, how are you?
Very well, thank you.
Thank you for having me.
Thank you very much. Now, Enoch, can you please explain to us the reasons that have led to this industrial action by health workers?
Thank you very much. The reasons that have led to this industrial action, one is the lack of dialogue between health workers and government. We have last had a dialogue with our employer, who is Health Service Board, for the past 14 months now. Secondly is the issue of salaries. The salaries that are being given to the nurses and doctors and other health workers, it's really below the poverty datum line. Thirdly is the issue of the working environment. The working environment which the health workers are working in, it's very, very, very unconducive. We talk of the protective clothing, we talk of medication that we use to treat our patients. We talk of equipment in our hospitals. We also talk of the buildings itself are very, very dilapidated. So those are the three major reasons why there is this industrial action.
All right, well, the government on Monday announced that all civil servants were to receive 100% salary increment. You still saying that this is not enough?
Yes, it's not enough. 100% of nothing is nothing. You cannot just give 100% of 30 US dollar. It will become 60 US dollar, and it will be not enough for a professional, somebody to earn 60 US dollar to have a living for the whole month. It's not possible. You need to feed your family, you need to pay rentals, you need to transport to go to work, you need to eat. And looking at what happened in the economy for the past 3 months, the volatility of the Zimbabwean dollar, as well as the increase in terms of the user fees, the increase in terms of the basic commodities, that will left us with other no choice rather than to demand a living wage.
Enoch, are you with us? Okay.
Yes.
So now, Enoch, let's talk about the efforts from the government. Have there been any efforts in this regard with union leaders? Have there been efforts from the government to meet up with union leaders? And have there been any more offers on the table?
Since I have mentioned on my first point that the major reasons why there is this industrial action is the issue to do with the lack of dialogue, which has happened for the past 14 months. They only met us on Monday for the first time legally, and they didn't come on the table with any offer. They just came in to hear what are our grievances, and we are still waiting for them to come with the offer which can break the impasse.
All right, we look forward to things, looking better for the healthcare sector in Zimbabwe. But thank you very much, Enoch, for joining us. We'll be looking forward to having you again when we hear some good news from Zimbabwe.